Hello everybody, it's Dr. Tuttle here, Leeward Chiropractic. I just wanted to put out a little video to help combat a lot of the hysteria and misinformation that's going around right now. I'll try and keep this short. There's really a lot to go over, but I'm just going to try and keep it at a very narrow focus. Because I see a lot of things that really concern me, a lot of things that really disturb me. I mean, every day I go to work and I see cops harassing people that are on the beach, you know, by themselves, not around anyone, just trying to go out there and fish. You know, I mean, the government isn't letting people work. A lot of them can't provide for themselves, and now they're not even letting them go and catch dinner because you know, you're not allowed to go outside of your house. You're not allowed to go to the beach. And they're treating this like the zombie apocalypse. And people are scared. I know people that are in their 20s that will not come to see me. They don't want to go outside of their house. They're home scared, wearing a mask. And it's absolutely ridiculous. So I just, you know, let me go over the actual facts. We got the CDC website right here. This is, I guess, the best source of information that we have. The CDC is the highest reference that you can get for infectious disease. But to be completely honest, their numbers aren't really honest either. But it's certainly a lot more honest than the ridiculous, irresponsible reporting we're getting from the mainstream media. You know, I've heard all kinds of ridiculous stories about how, you know, they're piling up bodies in ice skating rings in Italy, and how, you know, just the ridiculous case of conditions in New York and others. But let's go over the actual facts rather than just trying to scare you with a constant barrage of fear-based mass media. Let's look at what's actually being done. These numbers are updated today from the CDC's own website. And what we can see right here is that the total cases in the United States is 163,539. And, you know, guys, that's not a whole lot, especially considering the total deaths are 2,860. Now, when you do the math on that, this is a 1.7% fatality rate across all age groups. But this is a really interesting thing to note, is that these numbers, when you look at it, it says the data here, the numbers include both confirmed and presumptive positive cases of COVID-19 reported to the CDC. So, you know, these aren't even really exact numbers. There's so many deaths that are happening that they're just presuming that it was COVID-19. They haven't tested for it. They don't really know. And, you know, when you look at the numbers there, I mean, they're just guessing on these numbers. And so there's very few of the cases that are actually confirmed. So the truth of the matter is that these numbers are already inflated. But we'll, you know what, we'll give it to them. Fine. Let's go with the inflated numbers. You're looking at these numbers right here, okay? As of today, that's a 1.7% fatality rate, but that's across all age groups. And what you want to know is that, again, CDC's own website, right? Morbidity and Mortality Weekly Report, that 80% of deaths associated with COVID-19 are among adults over 65 years old, with the vast majority of that coming from patients over 85 years old. Now, by contrast, there's no deaths reported in kids under the age of 19, so your kids are safe. But, you know, you really got to look at that because, you know, it's 1.7 across the boards, but it's really high if you're 85 or over. And it's still significant if you're over 65. But, you know, 55 to 64, it's still like only a 1 to 3%, you know. And here's the interesting thing. If you're under 55, okay, it's under a 1% fatality rate. Okay, there's less than 1% chance that this is going to kill you if you're under 55, but it's really interesting when you get down here and you look at the actual numbers. If you're under 45, I'm sorry, if you're under 45, it's a 0.1 to 0.2% fatality rate. I mean, it's just, guys, it's not that bad. And what you need to understand is that with these statistics, it's not random. It's not a roulette wheel. This does not kill strong, healthy people. Let me say it again. This doesn't kill strong, healthy people. This kills people that are really old. This kills people that, you know, have severe pre-existing conditions, that are immunocompromised, that already have, like, you know, bad lung infections. This is not going to take out people that are young and fit and strong and healthy. Doesn't happen. Okay? And so, you know, what's happened is that these numbers are, I mean, honestly, I'm in disbelief for this complete non-threat. They've completely stopped society, travel. They've locked us down. I was, willing to put up with it for 2 weeks, but now they're extending it to 6 weeks. They're not letting people work. They're not letting people go to the beach. And for what? For a disease that is just not that bad. And now, yeah, I mean, there are at-risk groups. Okay, I mean, I'm not saying that there's not a health issue. What I'm saying is that they're doing far more damage with their response to it and their irresponsible reporting, and it's just not worthy of the attention and the response that it's been getting. And by contrast, you look at something like suicide, which is a leading cause of death in the United States. 47,000 people a year dying from suicide, So, I mean, it's just, I promise you the numbers of deaths from COVID-19 are going to get nowhere near this, but they're not doing anything to stem the tide of suicide. In fact, they're increasing it. I mean, you look at, this is from the National Institutes of Health, the Mental Health Division, and I mean, what do you think is going to happen when you take people and you force them to isolate themselves, you take away their job, you cause their bills to pile up, you keep them out of the sunshine, and you constantly inundate them with fear? Do you think they're going to be more likely to commit suicide? I mean, the answer is an obvious yes, and we're already seeing the number of suicides go up. So, guys, this isn't about health. This isn't because your government cares about you. That's just a laughable notion. I mean, they're actually killing far more people than they're helping with this, just in the suicide numbers. But it's not just about taking lives. It's about ruining lives and ruining people's livelihoods. I mean, for those of you that have a really good, well-paying government job, you're going to come right back to work. You're getting paid leave. You know what? Enjoy the time with your kids and play the video games or whatever. Or maybe if you work for a really large company, but for the people that that are like small business owners, it's just wrecking small businesses. And you know what? They are throwing us a bone through all these stimulus packages, but that's just going to devalue the dollar. It's going to make things much harder for us in the long run. Regardless, they're just doing so much damage with the irresponsible way that they've handled it, and like everything about the way they're handling it suggests that it's not about health. It's not about keeping you safe. It's not about what's best for you. And it's kind of interesting. Okay, yeah, shot by police. This is kind of interesting. If we take a calculator, okay, and realize that there's 2,860 deaths, but remember, 80% of those deaths occurred, in people over the age of 65 years old. So if we do a little bit of math here, that means that under 65 years old is only 20% of this number. So that means this has only killed 572 people that are 65 and under, okay, which, most people that are getting shot by the police are under 65, and there's 986 people that are getting shot by the police every year, shot and killed. So, I mean, you're more likely to get shot by the cops and die than you are to die of COVID-19. You look at stuff like, car accidents. I mean, you're averaging around 37,000 people a year dying from car accidents, but nobody's afraid to get in their car. They're not banning all motor travel because of this. And so, it's not that there's no health threat from this. It's just not a significant health threat. And it's like, this is just, guys, this isn't about your health. This isn't about keeping you safe. I think it's really laughable. I mean, if that's really what it was about, what you have to understand is that the coronavirus, COVID-19, started in Wuhan. Interestingly, right outside of the Wuhan University of Virology's BSL-3 lab. Okay. Now, anywhere you read, they'll say it's debunked, that it wasn't created, it's not a bioweapon. Well, I just find this just absolutely amazingly coincidental, right? So they were studying this. They've been studying coronavirus there for 10 years. And however it came about right there, right then, and this was like back in late October, early November, that it started infecting everybody, and it kind of blew up in December. And come on, guys, our government, the intelligence community, they knew about this. It became public knowledge in early January. So if it was really about health, if it was really about keeping you safe, they would have immediately banned all international travel way back in January, but they didn't. And you know what we saw? We saw a lot of people here in Hawaii that were really sick with flu-like symptoms, just like the coronavirus back in December, even as far back as November, but a lot in December and January. And so, you know, the flights were coming here the whole time. So the biggest thing you want to understand is that, guys, you've probably already been exposed to it. It had been here in the islands for months before they did anything about it. It was here for months before they made a big deal about it. So, you know, many of you have already been sick. Many of you have already caught this, or at least many of you have already been exposed to it. So that's the other thing that you really want to understand, is that this is not a real health threat. It certainly doesn't warrant ruining people's lives, ruining jobs, ruining the economy. What it was really about, you know, in my humble opinion, is the $2 trillion stimulus package that just got passed. And that's not the only stimulus package that's been passed. I mean, they're doing, at my last count, I knew of 3, but now I'm hearing rumors of a 4th bill for economic relief. And so it's just going to be about a massive gutting of the economy. And regardless, you know, the point is that if it was really about protecting the public, keeping them safe, there's better ways to handle it. What you would do is you would quarantine the at-risk group. Okay, I mean, look, Tutu is at risk. Okay, she should be quarantined, right? If you have pre-existing conditions, if you're immunocompromised, you should be quarantined. They should be locking the at-risk population up. They should be, you know, sanitizing everything, wearing a mask. Only one person gets to see grandma, and they're disinfected before they go in and see her. They should be doing immune boosting strategies. But, you know, you have to realize that there's only a very small segment of the population that's at risk. So you quarantine them and allow the other 90% of the population, especially the kids, what hasn't killed any kids, to go about their business. You don't close public school. You don't stop all sports that a lot of these kids are depending on to get scholarships and go on to college. You don't ruin their lives for something that hasn't killed even one of them. And then, you know, the population they'll get sick, man. You'll get sick. You'll get over it in a couple weeks. You'll have lifelong immunity. Then the population will achieve herd immunity, while Grandma Tutu and all the other high-risk groups are quarantining. And then once we have herd immunity, we can let them back into society, and we can do that all without destroying our economy, destroying lives, scaring the living daylights out of the population into giving up their basic freedoms and constitutional rights. And that's really the big concern here, is because every couple of years there's a flavor of the month pandemic, whether it's SARS, and this is SARS 2.0, MERS, avian flu, bird flu, whatever it is. If this becomes the new norm, the new standard of how we respond as a nation to to a health crisis, a self-declared health crisis. I mean, that's what I'm really in disbelief that they're actually declaring a state of emergency and calling this a crisis, because I mean they're calling this a crisis, and it's the numbers just aren't there to support it. Even the inflated numbers that we're seeing at the CDC just don't support this reaction. But if this becomes the new norm, it's just going to be a continual declaration of emergency powers and us giving up our rights. And that's really what concerns me. And so, you know, what can you do to protect yourself? Well, first of all, the worst thing that you can do is destroy your immune system by stressing out, by worrying, by staying inside and not getting any vitamin D from the sunlight, not getting any exercise. It's kind of ironic that the things that they're telling you to do are absolutely the worst things that you could be doing to keep you healthy. You should be getting outside. And the other thing is, like, if you just cross paths with somebody who happens to be infected or whatnot, it doesn't mean that you're going to get sick. I mean, healthcare personnel, I mean, the recommendations are, you know, close contact being approximately within 6 feet of a patient. But here it is, for a prolonged period of time. So if you're at the beach, you know, and you pass by somebody, you know, you're very unlikely to get affected. If you're out hiking, you're very unlikely to get affected. If you run by somebody, on the sidewalk, or if you're at the grocery store, incredibly unlikely. But being in close contact for a prolonged period of time, that can increase your risk because it's spread primarily through respiratory droplets from breathing, but also, look at this, sputum, serum, blood. And so one of my patients asked me, like, is it transmissible through blood? I said, yes, absolutely it is, And they said, well, why aren't they screening for this at all the blood drives? Because the blood drives are going mad right now trying to collect blood, but they're not doing anything to see if the people who are donating blood are infected with COVID-19. So they're really just going to be helping to spread the disease. I mean, it's just completely irresponsible what they're doing. It's irresponsible of the way they've handled this. They should have stopped international travel months ago when it was an actual issue. They should have just quarantined the the at-risk groups and allowed people to, for heaven's sakes, get the sniffles, get well, develop immunity, and get over this. And so, again, back to what you can do to protect yourself. Okay, get sleep, get exercise, get in and get adjusted. That boosts your immune system. Do things to boost your immune system. One of the best things is vitamin D. Yeah, you can get it from the sunlight, but especially right now, I mean, that may not be enough, so you can supplement with liposomal vitamin D. I have a great brand of that. You can ask me more about it. Then there's, also zinc. Zinc is the #1 mineral for the immune system, and I've read some preliminary reports suggesting that a lot of the people that died from COVID-19 were zinc deficient. I mean, I don't have rock solid evidence on that, but I have heard that, and it does make perfect sense because zinc is one of the things that boosts your immune system. So get good sleep. Stop inundating yourself with fear-based mass media program. Turn off, Fox News, CNN, MSNBC. If you really need to know about anything, you can go get information from the CDC website. But again, even that's not completely honest. And this whole fiasco, guys, is just simply not. It's not about your health. I mean, it's really not. Your government, guess what? They don't care about you. Okay, it's not about that. So if there's any questions, please feel free to contact me. But I just want to reassure you, especially most of you who are my patients. I think I only have one patient who's over 65. You guys are not at risk. If you guys are doing common sense things, you're going to be healthy, and I can't guarantee that you won't get infected. You're not going to die from this, guys. You're just not. I mean, for heaven's sakes, you might get sick, you might get a cough, at which point, yes, you definitely need to be quarantined and, watch the spread of it, but then you'll get over it. You'll be just fine. It's just not worth all the fear. If any of you want more information, please feel free to call me. Take care of yourselves. I look forward to seeing you guys soon. Aloha.